Okay, good afternoon, everybody. We're going to go ahead and get started. So thank you all for being here this afternoon. My name is Melissa Bogoslawski, and I'm the program manager for Project Healthy Schools. And if anybody signs in a few minutes late, just know that this is being recorded and that we will have this available for everyone after our webinar is done this afternoon. So I wanted to, again, thank you for joining us. Project Healthy Schools is a unique funding opportunity through Building Healthy Communities, which is a partnership through the University of Michigan and Blue Cross Blue Shield of Michigan. Again, so Building Healthy Communities, Engaging Middle Schools is through Project Healthy Schools is a collaborative effort through multiple partners from across the state of Michigan. Of course, Blue Cross Blue Shield of Michigan, University of Michigan, which is us, Project Healthy Schools, Wayne State University Center for Health and Community Impact, as well as the United Dairy Industry of Michigan. Next slide. So just a brief introduction of myself. Again, my name is Melissa Bogoslawski. I'm the program manager of PHS. I'm coming up on just a year of being here with Project Healthy Schools, and it's been an absolute joy working with the team. My background is in health behavior, so I have a PhD in health behavior with an emphasis in education, law, and leadership. I have my MPH degree, and I have just over a decade of experience working with K through 12 populations in health programming, evaluation, and research. And then Ben, I'll hand it over to you if you'd like to give an introduction.
Hello, everybody. I'm glad to be here with you this afternoon. My name is Ben Ranciere. I'm the Curriculum and Training Coordinator for Project Healthy Schools. I have my master's in educational leadership, post-bachelor's in physical and health education, and I enjoy coaching youth sports. So really happy to be here with you today to share a little bit more about our program. I'll turn it back over to Melissa.
Awesome. Thanks, Ben. So just a few logistics. I mentioned a few right when we started, but copies of the slides will be emailed to all of the participants after the meeting is done today. Feel free to use the chat or the question and answer feature throughout the meeting if you have any questions or comments. Note on the live transcription, you may turn off if you like to click the CC box and then hit hide subtitles if you would like. And again, this meeting will be recorded and posted to our website. And again, this will be sent out also if you were registered for the webinar. So then a brief overview of what we'll be covering today. So it's a half hour, but it's going to be an information-packed half hour. So again, we'll go over what is Building Healthy Communities, Engaging Middle Schools through Project Healthy Schools, eligibility to apply for our program, an overview of our 5-step program through PHS, resources provided to participating schools, the expectations we have of participating schools, how to apply, criteria for selection, as well key dates that will be important to remember for application. So just to give a brief overview of the current landscape we have in the state of Michigan. In the state, we have the unfortunate statistic that 1 in 3 children in our state are overweight or obese. And just to give a little context, a recent study just came out from the CDC through the 2 years of the pandemic, and they showed that actually students from the ages of 2 to 19, we saw almost a doubling of rates of obesity and students who are overweight and obese throughout the country, particularly those students who were already classified as overweight or obese. And the CDC recommends that the best way to intervene with that or to prevent that is through evidence-based programming. Project Healthy Schools, which we'll go into that a little bit more and how to show just the effectiveness of our program. But we know that there is a strong link between health and learning. We know that students, when they're physically active and eating healthfully, that they can achieve academically and that they are paying better attention in school. They're more engaged when they're in school. So it's a great opportunity to improve the health of our students, but then also help enhance their academic achievement as well. So again, PHS, we're a community Michigan medicine collaboration to improve the present and future health of youth through education, environmental change, and community engagement. So just to give kind of a background, so we started in 2004 with a pilot school in Ann Arbor, and you can see since 2004 how much we've been able to expand across our great state of Michigan, up to the UP and all over the state. We, of course, would love to see more of those blue stars as we continue to expand our program. You can see that we've reached over 112,500 students, and we have reached over 140 schools. So you can see the red stars are the schools that are new with us this year. And then we'll be looking for 10 new stars starting for the 2022 school year. So then the goals of Project Healthy Schools. So we are a sustainable framework that we tailor to every school's needs, and Ben will go into this in more detail. But it's not just a package program that we give to you. We work side by side with every school that is participating with us to make sure that, again, that all 5 of these goals are met based on your school's specific needs. So we promote our 5 primary goals that we promote are to eat more fruits and vegetables, choose less sugary food and beverages, eat less fast and fatty foods, be active every day, and then to spend less time in front of a entertainment screen. We know that can be a little bit tricky after the past few years, really emphasizing spending less entertainment time in front of screens. Again, just to show the effectiveness of Project Healthy Schools, we work closely with our team over here at MCORE, which they collect all of our data with us. Again, Ben will go into more of those details, but to show just some of our incredible outcomes that we have through PHS, students who participate in Project Healthy Schools, we see a 59% increase in students eating more fruits and vegetables. 58% of participating students are more physically active. 44% of participating students end up choosing less sugary foods and beverages. And we have a 35% decrease of entertainment time spent in front of a screen. Really great outcome. So to show eligibility for PHS, we are a program that's eligible for all public, charter, or private nonprofit schools. It's available to all schools, regardless of your free or reduced price eligibility and percentage of your student population, as well as geographic location. So you saw that map a few slides back. We are available to any school across the state of Michigan. Schools participating in other health programs are eligible. However, if you are part of another program within the Building Healthy Communities program, then you would not be eligible because you're already participating with another BHC program. If you have any questions or aren't sure if you're eligible, please feel free to reach out to us. Our contact information will be at the end of the slides. If you're not sure if you're eligible, we'd be happy to find that information out for you. And then lastly, schools must serve students in the 6th grade to be eligible for PHS. So I'll go ahead and hand it over to Ben, and he's going to get into the details. Into the details of our program, and I'll turn it over to Ben.
All right, thank you, Melissa. So I am here to share with you a little bit more about what program implementation will look like at your school. But before I do, I'd like to welcome those of you who have just joined us as part of the Building Healthy Communities, Engaging Middle Schools Through Project Healthy Schools webinar. To provide you just a brief overview of what the program entails and what it'll look like on your campus. So let's jump right into that. So we will work with you to follow what's called our 5 steps to school wellness. And this is a repetitive process that will happen year over year at your school in collaboration with the Building Healthy Communities, Engaging Middle Schools Through Project Healthy Schools program. So take a little bit further dive into each of these steps. But before we do have a Project Healthy Schools portal, which will house all of the resources related to each of those 5 steps that will support you through implementation across each of those 5 steps. Once you're accepted into the program, you'll receive your login information. And again, this is where the portal, you'll house all of our curriculum materials, all of our assessment materials, wellness initiative ideas, which we'll get further into as we progress here this afternoon. We'll start with step 1 within the process. So this is building support on your school campus to revamp or revitalize the school wellness environment for students and staff at your school. The first step in doing so, we will identify one or more wellness champions at your school. So if you're on this call today, chances are you will be one of the wellness champion or one of a few wellness champions at your school. And you will be our main liaison, connecting with a EHS wellness coordinator here. We'll have a dedicated wellness coordinator for your wellness champion in your school. Your wellness champion will start off by forming what's called the school wellness team. That's a collection, a variety of school stakeholders that can help assess, develop goals for implementation, develop a plan for implementation, which will include your wellness initiatives, to support the implementation of each of the 5 steps. And then we'll use a variety of tools to engage your school community. So we use some social media resources. We've got a wealth of information that can be provided to your school community that will help update them with progress along the way. Before I jump into step 2, I just want to remind each of you on the call that we do have the chat function. So please feel free to use that. If you have questions throughout, please feel free to post those, and one of us will respond either through the chat or verbally as we continue on here. So please feel free to post any questions that you might have as we go through. All right, step 2, here's how we're going to really individualize the program on your campus. We realize that schools, and we work, as you saw the map, we work with over 100 schools across the state, and there's unique needs across each of those schools. So we will tailor the program to meet the individual needs of your school, and we'll do that by assessing your school wellness culture. And we'll use a variety of HSAT assessment tools, which again will be linked into our portal for easy access into those assessment tools. We find that they take about 1.5 to 2 hours to complete. And then once we have that assessment data, that will really provide us clear direction for us to make an action plan. And here, after we analyze the assessment results, we will identify some SMART school wellness goals for each member of your wellness team and school community to kind of follow as we progress through implementation. Here's where we'll plan some of our wellness initiatives that we will also utilize to help meet those identified SMART goals for wellness within your school community. Once we have our action plan, we get to the really fun part, which is step 4, taking action. Here is where we will teach our 10 Project Healthy Schools nutrition and physical activity lessons, as well as 20 social emotional learning lessons through our partnership with Trails, which we'll talk a little bit more about here in just a few minutes. So we'll be teaching students about social emotional wellness and nutrition and physical activity in a variety of ways. Also during this phase, we'll also implement those 4 school-wide policy systems or environmental change initiatives. Here's a little bit further look of the educational lessons that we have, and we do offer a variety of implementation methods for our lessons. So we do offer traditional school-based, classroom-based lessons where we'll provide all of the educational materials, curriculum materials that you'll need. We also offer online synchronous and asynchronous versions of the lessons as well, which we'll have access to again through our Project Healthy Schools portal. Here's just an outline of some of the topics that you'll be covering with students throughout each of these 10 lessons. As mentioned earlier, we also will provide 20 developmentally appropriate brief lessons, which are aligned with Michigan's focus on student safety, health, and wellness, again, through our Trails collaboration. Trails stands for Translating Research into Action to Improve the Lives of Students. And if you're interested in seeing some more information about Trails, you can see the link to their website below. But within each of these 20 lessons, students will learn the skills that you see on the wheel up in the top right corner. So students will learn about improving self-management, self-awareness, responsible decision-making, relationship skills, and social awareness skills, again, to improve the emotional, social wellness of students at your school. All right, so during the take action phase, we talked about those 4 wellness initiatives that we'll be working on throughout the course of the year. Those can take many different shapes and forms, but we like to see those wellness initiatives refer to either a policy change, so maybe that is revitalizing your school's school wellness policy or a portion thereof. A system change, which could refer to how you do things at your school. So maybe that's working with food service to put some of those unhealthy options out of view, which has been shown to decrease the number of unhealthy foods that are being eaten in the lunchroom. Or an environmental change. So we might be revamping the actual physical, social environment of your school. So maybe we'll be working with a student group to design some nutritional signage for the lunchroom, or installing some water bottle filling stations within the physical environment of your school to promote proper hydration. So again, your wellness coordinator will work directly with the wellness champion and the school wellness team to identify those goals and then figure out these policy systems or environmental change initiatives that will help meet those outlined goals throughout implementation. All right, lastly, we will measure success. And how will we do that? So we do have a few different surveys which students will need to complete throughout the course of implementation, one of which is our Health Behavior Questionnaire. That's a pre and a post assessment. So we'll take a look at baseline health, nutrition, physical activity behaviors with students. We'll implement the program, and then we'll circle back and do a post-implementation follow-up to really identify where we're hitting the mark with those outline changes that we're looking for, and where can we revamp going into years 2 and beyond to help support the whole child. We'll also have a post-lesson survey for students and teachers involved in implementing the lessons to complete. And we will ask that you share some photos and some success stories of how the program has positively impacted a student or a group of students or a teacher or a group of teachers within your school. Again, questions on any of these 5 steps, please feel free to post those in the chat section. All right. Some of the resources that will be provided to your school as we implement the programs. You will receive lots and lots of on-site or remote consultation from your dedicated Project Healthy Schools Wellness Coordinator. You'll also receive a lot of support from Trails clinical professionals as you work to implement those 20 SEL lessons. So this, our Project Healthy Schools Wellness Coordinator will be assigned directly to you and your school, and we will help train, guide, and assist and facilitate all those activities, kind of using that gradual release model. So you'll see us on site quite often at the beginning, and then as we progress through implementation, we'll be gradually kind of turning those responsibilities over to your wellness champion at your school, with continued support throughout. Again, you'll be a member of the Trails Network, which means you'll have additional training opportunities to improve the social emotional environment for your school. You'll receive the curriculum materials for those 20 SEL lessons. You'll also have access to other SEL information as well as support calls. So if things come up, topics come up that the teacher is not quite sure of how to handle within those 20 lessons, they can attend a support call to get further consultation from a Trails clinical professional. We'll also provide the curriculum materials, as I said earlier, and all of the lesson materials needed to facilitate each of the lessons. A few more resources. So some funding. You will have direct wellness team funding. So we talked about those 4 wellness initiatives. You will receive funding to help support the implementation of those wellness initiatives. You'll also receive funding to support a comprehensive school physical activity program. So we'll be providing you funding to purchase physical activity equipment for a variety of different programs that you may have or are looking to implement throughout the course of the school day to get students up and moving more throughout the course of their school day. We'll also be providing the Wellness Champion a stipend. We know that we're asking you to go a little bit above and beyond your regularly scheduled duties. We'd like to compensate you for your time and effort in helping to really revamp the wellness environment at your school. You'll also be part of our Wellness Champion Network, along with all of those other wellness champions on that map that you saw, where you'll be able to connect with them to garner ideas, and also earn continuing education hours. All right. So lastly, some of the things that we'll be expecting from you as you work to implement the program in collaboration with our Project Healthy Schools team and the Building Healthy Communities team as well. Having that active wellness champion and administrative support has really been shown as a successful model for implementation of this type of program. You'll be asked to, meet quite regularly with your Project Healthy Schools wellness coordinator. Again, that could be on site, that could be remote, whatever works into that wellness champion schedule. You'll be asked to, again, complete those Healthy School Action Tool assessments, which consists of 3 assessments, one that takes a look at the overall school environment, one that takes a look at the nutritional environment, and then there's a physical activity, physical education assessment as well. You'll be expected to teach the 10 Project Healthy Schools nutrition lessons, as well as the 20 social emotional learning lessons to at least one grade within the school. You'll be asked to complete those 4 wellness initiatives, administer those online measurements, Health Behavior Questionnaire, and the post-lesson surveys, as well as share those photos and success stories so we can see and hear about all the wonderful things that are happening as a result of your efforts. And then a commitment to sustaining these wellness efforts beyond year 1. We understand that we can kind of see this more as a marathon more than a sprint. And we will continue to provide that support beyond year 1, as well as additional funding opportunities to support the implementation of the program beyond year 1. All right, so I am going to now turn it back over to Melissa, who's going to share a little bit more with you about the application process itself.
All right, thanks so much, Ben. So again, to apply for our program, so the links are on the slides, and we'll make sure to have those available to you as well through email. So what you'll need to do is review our application. You'll also see a frequently asked question page, as well as other information on our program on our website. So that's projecthealthyschools.org/apply-now. And again, all these links will be made available to you. Our application is also on our website. So you'll still go to that PHS website. And then our application deadline is by 11:59 p.m. on August 26th of this year. For this year, we encourage our schools who are interested to apply early. We will be scheduling interviews as applications come in. So if you would like to have your interview scheduled before the end of the school year, we strongly encourage you to submit that application before the school year wraps up. We know that you're all very busy. And again, if you have any questions about the application, if you run into any questions or need more details, our contact information will be on the slides at the end of this presentation, and you can reach out to us directly as well. So just a few tips for a competitive application. We have a rubric that we use to select our 10 participating schools for next year. So first, of course, is a complete application. Second would be for us to take a look at your level of commitment from administration and staff to complete all 5 program steps, including that Healthy School assessment tool, and how well you can sustain the Project Healthy Schools program over the course of 2 years. And we, strongly encourage your administrators to be engaged throughout the entire application process, to also identify whether it's a PE, a health, or a core class where your 10 PHS and the 20 Trails SEL lessons can reach at least 1 grade level at your school. Again, your school needs to have 6th grade to be eligible, so please keep that in mind. Also, to identify your wellness champion or champions. You can have more than one, especially if you have a lot on your plate. You can absolutely divide and conquer those duties with a colleague, as well as your other wellness team members. And also to see the level of commitment to improve the healthiness of your school's policy systems and your school's environment, as I mentioned as he was walking through the program. So next steps, again, is to apply by August 26th. And as I mentioned in the last slide, we are scheduling interviews for before the end of the school year. So if you'd like to apply and have your interview scheduled before, mid-June, please get those applications in as soon as possible. And we'd love to have those scheduled sooner than later. Again, after you submit your application, then we'll follow up with that interview. And then implementation will begin in the fall of 2022. So again, thank you all so much for attending. We'll go ahead and pause for just a few minutes to see if there are any questions. Again, you can see our general email and our phone number. Ben and mine's emails are also listed here. So we'll go ahead and pause. Again, feel free to drop a question in the chat box if there are any questions regarding the program application. Again, this program is of no cost to your school. So all the resources, all the funding comes from the BHC PHS program. So just keep that in mind as well. If you know how to take this back and speak to one of your administrators, just know it's no cost out of pocket for your school. And we're always happy to provide as much technical assistance as we can for your school, even through the application process. So don't be afraid to reach out to us if you have any questions. But I'll pause and see if there are any questions from any of our attendees. Okay, well, if there are any, well, thank you all so much for attending. I know it's a busy, busy time of year, so thank you for taking time out of your schedule to meet with us. And again, reach out to Ben or myself if you have one of those questions that pop up in a couple hours when you're having dinner. Feel free to shoot us an email. Again, we're happy to walk through any questions that you may have for the application. It is live right now on our website, so you can pull that up and take a look and see what information you need. But again, we are here and available for any questions that you may have. Feel free to share this information if you have any other colleagues in middle school or any colleagues across the state of Michigan who you think that PHS would be a good fit for. Feel free to share this across your networks. We'd love to have as many schools participate with us as possible. Tammy, go right ahead. I see that your hand's raised.
Are you able to hear me now?
Yes.
Okay, great. We participated before Pastor Elementary did years ago before the pandemic. And I also ran the after school program. So will this be similar to the way it was before?
Nate, did you hear that at all?
Did you hear me?
I can hear you just a little bit. Let me see if I can get my volume turned up on my computer.
Yeah, because my volume is up, so.
Hold on.
Okay, do you think that's better? Can you hear me better now?
Okay, you're much better now, Tammy. Go right ahead.
Great. What I was saying is that Pastor Elementary, we participated with you guys years ago, and I ran the after school program for the kids. So will this be similar to what we did before?
So you previously participated with Project Healthy Schools, correct? Correct. Yes. So if you participated with BHC were you with Wayne State or with us here at U of M?
It may have been with Wayne State because I know we did our training and we went to Wayne State and had, the training. Okay. So is this similar or?
So it's similar. So the programs all have very similar objectives, but the programming may be a little bit different. What I can do, Tammy, is I'll jot down, what's the name of your school again?
Pasture Elementary.
Okay. All right. And what we can do, Tammy, is if you don't mind, I'll take a look and see who you participated with, and then either direct you to that. So if you were with, so it looks like, so Shannon, who's here from Blue Cross Blue Shield, so she's one of our partners from Building Healthy Communities. We can refer you back to, it sounds like it may be a step up school. So what I can do, Tammy, is I'll look that up and I can get you that information, let you know exactly, and so we can get you back to the proper program so you know how to continue on with that program.
All right, thank you.
Of course. And thanks for your help, Shannon. All right, any other questions from anybody else? Okay, well, again, it's 4 o'clock on the nose. Want to be respectful of everyone's time. So thank you all again for your time this afternoon. Feel free to reach out to us with any questions, and we look forward to your applications, hopefully in the next coming weeks. Have a great afternoon, everybody, and we'll hear from you soon.